Samoa's Director General of Health has confirmed to RNZ Pacific that border restrictions haven't been recommended, despite recent media reports suggesting they may be considered. However, Aiono Dr Alec Ekeroma says the Ministry of Health may recommend increasing COVID-19 testing at the airport if cases continue to increase. He speaks with Caleb Fotheringham.
I've never said that we're going to introduce border restrictions. We might, of course, recommend to government that we have widespread testing at the airport if the numbers stack up. But right now, we haven't made that recommendation to government. So only government can actually articulate closing of borders or restrictions at borders. We make recommendations to government, and it's government to actually then approve or disapprove. At the moment, as you know, the numbers of COVID cases in Samoa is increasing, and that is expected because of the increase in cases in New Zealand. And we have something like 2 daily flights from New Zealand a day. So we expect an increase in numbers, and we have demonstrated that there's an increase in numbers. We're going to continue testing. At the same time, we have advised our community to obtain their COVID boosters, because that will protect the community and the public. So far, the response has been poor, but I'm hoping really that with more news of an increase in COVID numbers in Samoa, those who are at high risk of getting and or having severe disease will come forward to have their boosters done. But the Ministry of Health is going to continue increasing testing, especially those who are symptomatic. So we're not doing sort of widespread testing at the moment. We're just doing testing for those who are symptomatic, presenting to hospitals.
So has the Ministry of Health recommended to the government to start testing at the borders?
We are only testing those who are symptomatic. So those coming off flights, of course, they fill in that form, the arrival form, and in there they will indicate whether they have fever or cough. So we are actually putting up signs there to say, we are giving out pamphlets to say that if you are symptomatic, then we have a testing station there. So we're not testing everyone because we don't want to affect the movement of people in the airports just yet. We're only testing those who present and who are symptomatic.
So has the Ministry of Health made any recommendations to the government yet on anything related?
No, we haven't. So the report in the Global News is not correct.
I see. And just on the testing that I guess is already happening, are they just rat tests?
So most of them are rat tests. But we are also increasingly doing PCR. So the problem, of course, with PCRs is that there has to be 2 swabs taken. And people don't normally would like 2 swabs, and also more expensive. But we know, of course, there's an underestimation with rat tests. So hence the reason why we are also testing those who have negative rats because of that fact.
If someone tests positive, what are the consequences to that? What do they have to do?
Well, at the moment, people who test positive are asked to self-isolate at home because that's a current policy. And only if they are severely ill, of course, then they need to come to the hospital and they will be isolated in the hospital. But right now, we don't have an increase in SARIs. These are severe respiratory symptoms. We don't have an increase in that, and so that's good. If there was an increase in people admitted with severe respiratory symptoms, then of course we will have to review the advice to the public, and also then we will have to advise government.
How many COVID cases do you think are in Samoa right now?
I think that the numbers at the moment is about 30, and since we started testing again. But I feel that probably that's an underestimate because, as you know, we're only testing those who have symptoms. It's possible for asymptomatic people to have COVID. So it could be 2 or 3 times higher than what the numbers show. And as more flights arrive from New Zealand and from the United States over Christmas, we can bet that the numbers will increase. And as long as we don't have severe disease and people admitted for, to hospital, to our intensive care, for example, then we will just remain at testing those who are symptomatic and advising the public again to get their boosters done.
I suppose just with the current situation, testing people at the borders and only testing people who say they are feeling symptoms, I could imagine people who might be feeling symptomatic. I imagine a lot of them will say, no, they're not feeling symptomatic because they're probably on holiday and they probably don't want to self-isolate. Do you think that could be a problem?
Yes, that will be a problem, and that is possible. We're hoping, of course, that people will be telling us the truth, that they are not well and that they need to be tested. But you are absolutely right that there will be some people that that will lie. And the current government policy, of course, is to live with the virus. That's the current government policy. So as long as there's no increase in the number of people admitted with severe symptoms to the hospital, and as long as more people come forward for their boosters, I suppose there's sort of no huge concern for us, and we won't be advising the government, of course, for any border restrictions. But we will have to monitor for the next, few weeks as the Christmas season peaks and more people coming in, whether there's going to be any increase in severe disease.